The picture previous is the week before I was diagnosed, the week before I had CRPS. I didn't realize how grand my life was. We were celebrating our 25th wedding anniversary. We had just had 2 daughters get married, and then another had a grandchild, and we traveled the world. And in this picture, I'm celebrating our anniversary. And at the end of the week, I had a routine heart cath, and unfortunately, I had a bleed, and it was a very traumatic event for me. They did surgery, and then after surgery, I went home to recuperate, not understanding why, after 6 weeks, I was in more pain than I was in the beginning. That started our journey with many doctors. Thankfully, my husband and my children were very diligent in helping me to research doctors. But in the end, it really came up pretty empty. When we tried to find a doctor who could diagnose my condition, I had never heard of complex regional pain. I went to a pain specialist in South Bend near us, and the doctor told me asked me for the first time, had I ever heard of RSD, or complex regional pain? And he had a really sad look on his face. And I said to him, no, I've never heard of that. I don't know what it is. I just want something to make my pain better. And he was going to give me pain shots, but he said he would not treat me unless I had a formal diagnosis. So about a year into my pain, I was diagnosed at the place where I had the bleed. And then I went back to Dr. Cook, and I also was seeing my family doctor, who continued to prescribe narcotics for my pain. And in the end, I was on about 2,800 milligrams of Neurontin. I was on Oxycontin. I'd been on Vicodin, and that started a terrible time in my life. Probably one of the darkest parts, because the narcotics made my pain worse, and I couldn't explain it to anybody. My family doctor didn't understand. Dr. Cook, my pain doctor, was very kind, and we figured out after about 6 nerve blocks that what was helping me the most was the Versed that he gave me to help me. He also noted that I had 10 degrees difference in my feet of temperature, and probably the hardest thing that I've had to deal with is that sometimes I might look fine, but inside my body is screaming with pain. It can be stress, it can be temperature, it can be an injury that ignites the complex regional pain. I'd like to stop here and say I am so fortunate to have met Dr. Weinstock. I am so grateful that he is speaking and continues to pursue complex regional pain. My injury was in 2004, and it was 2013 when I finally met Dr. Weinstock. My heart doctor recommended for my angina that I originally had the heart cath for, that I see Dr. Weinstock, that it could be GI related. And I'll never forget the day that I walked into his room and I sat on his table, and he had this big smile on his face, and I thought, I don't think this is going to be fun. And he said, I hear you have complex regional pain. And I kind of groaned and said, uh-huh. And he said, I've been looking for somebody for a while. And he was so excited. And the months that pursued, he would call me, he would text me, mostly texting or emailing, and asking me questions, some of the strangest questions, like did I have troubled pregnancies? Did I have joint issues? And in 2007, I slipped on the ice and shattered my ankle. And in 2009, I had it rebroken. And in 2012, I had it replaced. And all of this was prior to Dr. Weinstock. We had finally learned that narcotics were bad, but that didn't mean that I didn't have to go through withdrawal, which was terrible. My children, to this day, hate complex regional pain probably as much as I do, because they saw their mother being so drugged and suicidal because I didn't want to live in the state that I was in. I remember my son was 12 years old, and he laid down with me in bed one night, and he said, "Mom, I really wish you had cancer." And I said, "Buddy, why?" And he said, "Because if you had cancer, Mom," he said, "they could either treat you or you'd die and go to heaven. I hate to see the agony that you live in." And so that's probably been the hardest part, is the emotional pain of complex pain that it's had to do with my husband and my family and my grandchildren, because they've seen me live in pain. In 2015, I was diagnosed with invasive lobular breast cancer. And so that was another step in my journey with complex pain. Thankfully, we'd learned a lot from my ankle surgeries, and they were able to do my double mastectomy with pain blocks. And then, unfortunately, I had to have another surgery because the complex pain causes the blood flow to stop, so I didn't have healing in the reconstruction process. They had hoped to do a one-step double mastectomy, reconstruction. They felt like that was my best chance. And after 72 days of infection, I had another surgery, and they removed the implants. So, complex regional pain is a horrific disease. I've met a few people through the internet or through doctors that know about it. A very frustrating part of complex pain is doctors don't understand it. Recently, I've postponed doing the video for Dr. Weinstock because I had a ruptured disc in my back, and the complex pain ignited. And I hadn't had that for quite a while. Dr. Weinstock had treated me, and I'm sure he'll share with you what he treated me with, and he helped me understand that I probably had a sleep apnea, which I'm now treated for, very severe sleep apnea with a BiPAP. But every doctor that I would go to, like the sleep doctor, he said, you're not gonna have sleep apnea. You're a female and you're not very overweight. But when he checked me, he was amazed at the times that my brain would, that I wouldn't breathe during my sleep. So I'm on a BiPAP machine, which helps me to sleep somewhat. Dr. Weinstock's drugs, medications have helped me to almost cure my IBS that I had for years, that I didn't realize was kind of connected to the complex pain. If I eat sugar, which I shouldn't, then I have a spell, but he gives me medications that helps me get through it. And so I'm just so grateful for his medications.
Tammy, why don't you tell them, since you've met Dr. Weinstock, not only how has it dramatically improved your IBS, but how has it affected your complex regional pain?
Oh, it's been dramatic. I was very skeptical in the beginning because I had never found anybody that could really help me, somewhat help me, as Dr. Cook did with the Versed, my psychiatrist did with some mind-confusing meds. But what Dr. Weinstock did, his research, his study, his everything, I found myself in remission for one of the first times, and it was awesome. It was just unbelievable. What else to say?
Why don't you just end? I mean, you've kind of told them your story, and now you're dealing with a herniated disc, which ignited the complex pain. But even then, Dr. Weinstock was able to help reduce it with the narcotics or the
Meds.
The meds. So why don't you just very quickly tell them the dosage of the antibiotics that he has you on, and how he treats it, and if you have a flare-up, and then I'll ask one more question.
Okay, Dr. Weinstock, I'm sure will share with you, he treats me with Exafan, naltrexone. I have done at Compound Pharmacy, erythromycin, and Dexilant. And just by him controlling those meds, it has made an amazing difference in my complex pain. I so want Dr. Weinstock to continue his research. I was so excited when he told me he was going to be speaking to the doctors in Nashville. And it just gives me great hope for the future that complex pain won't just continue to be such an unknown disease. When recently, through my ruptured disc in my back, I ended up in the ER at a very good hospital, and the doctors had to Google complex pain, and that was very disheartening. And after 5 different drugs they tried, nothing would touch the pain from my ruptured disc and from my complex pain, which was ignited. I'm sure it was caused by stress, because the stress of the unknown, and it was hard to explain to the doctors. They sent me home with anti-anxiety medicine, which was so frustrating until I got to Chicago and had an MRI of my back. And that's just the frustrating part, is the doctors who don't know about complex pain or who treat you like there's something wrong with you, that is mental.
So Tammy, you're really looking at a time span from 2004 until today. 2 times you had to come off of narcotics, but now today, even facing a herniated disc, what is your realistic hope for the future?
I have great hope for the future, and as I get back to living, I've never wanted to live so much in my entire life. I enjoy life. I'm very grateful for everything Dr. Weinstock has done. I'm grateful for my family, and that's probably been the hardest, is the emotional effect it's had on my family, my 5 children, my husband, and my grandchildren. But I'm excited because I'm not giving up, and I don't believe Dr. Weinstock will give up either. So I hope that you all can help him, and he is very welcome to use my video in any way that could help complex pain victims, because it is a terrible, terrible disease called the suicide disease, and it's very sad and very hard. And while my life is not like it was in 2004 before complex pain, you know, I have a good life, and Dr. Weinstock has helped me to be able to control complex pain, which is a miracle to me. So I thank him with all my heart, and I hope this helps somebody.